Okay, hello, this is Christine Deal, and I'm going to just kind of briefly go over Chapter 4. This is with the goal of helping y'all with your community assessment project. So the PowerPoints are posted, so I just wanted to verbalize a little guidance as you do this project. Okay, so from the assessment data, that's when we can mobilize and create plans. Okay, and the time from the assessment to the actual delivery or implementation can take many, many months to years. So it's a very ongoing process, but we have to start by collecting the data, analyzing the data, and then figuring out how best to use it for the greater good for the entire population that's identified. Okay, so now you could have a population that's community, like the entire, like a broad community, or you can, in your assessments, target a specific group, like the elderly, or children with asthma, or Alcoholics Anonymous. Okay, those are just some examples. Okay, so here's some information just from the Institute of Medicine saying that assessment is a core public health function, and from that comes policy development and then assurance of intervention. And so that was in the introductory explanation of the three core themes of public health, because those are all critical to public health. And that was on a previous recording in 440. Okay, so in order to conduct an assessment, you have to have the appropriate data collection methods, okay, which for y'all is going to start with a windshield survey, and be very specific on that windshield survey. Don't just say there are numerous restaurants, or numerous churches. What specifically are the resources in that community that you're seeing? When you're looking at safety, do you see presence of police officers? Do you see signs in people's yards that indicate that they have some sort of a security alarm system? Okay. Also, what do the sidewalks look like? Are there sidewalks? Are they well lit? And are the sidewalks in good repair, or are they in disrepair, which of course makes them unsafe for walking? Okay. Also, if it's not lit well, it's unsafe. So just be very specific in what you're seeing. If you see parks, if you say numerous parks, what are those parks being utilized, and by what groups? Who you see most in your initial observation in these parks? Are the parks safe? And if people aren't using the parks, what are some of the reasons? That could be some of the things that you then fine tune and hone in on in your specific surveys to assess the needs of a community. Okay, remember, community is a group of individuals who share a common denominator. There are certain community boundaries, which can be, like I mentioned, children with asthma, or they could be boundaries that are geographical. Okay. All right. Okay, so structure, competence, and health status are used in defining the health of a community. Okay, and so statistics commonly used when doing a community assessment that are related to health and disease, that's covered in chapters 3 and 9, but all those include indicators as mortality rates and morbidity rates. Okay, so what is the health status? What is the structure of the community? What is it primarily, like what's the statistics of youth versus statistics of the elderly? What is the health status? Is there a high rate of accidents in this community? Is there a high rate of stroke? Okay, and all those you can get on morbidity and mortality websites. Okay, so CDC wants to promote healthy communities. We know about the Healthy People 2020. So establishing healthy communities programs are very important to the ongoing health of a community. And communities need to be engaged in preventing non-communicable disease. So it takes multiple members of a community to strengthen that. And so collaboration between communities and national resources are a component of this. All right, I've already talked about the mortality and morbidity and as indicators of health. Okay, other indicators of health would also include that the community has enough assets to promote healthy lifestyle, healthy living, and assets being strengths within that community that have been shown to support healthy relationships, healthy living, and positive effect of the community. Also, what services and resources are available, we discussed that. So you'll do initial with your windshield survey, but then as you do some literature search on the community, you will get some more defined information there. Okay, so measures of community competence include, commitment to the community. So are the community members sort of disjointed? Are there some common ground? So is there any kind of conflict containment and accommodation? I mean, how does the community work together? Certainly for success, you need participant interaction. Okay, so you're going to decide who the stakeholders are and figure out who you're going to, once you identify what your project is going to be, who will be involved in that. Will it be law enforcement? Will it be schools? Will you plan to, and remember your project is just a plan, it's just a proposal, but you want to identify the steps in that because you want to include several community members. Could be city council, it could be planning and zoning, it could be, like I said, the police departments, it could be, school personnel, for example, and of course the local public health department. And then y'all get together and decisions are made. And again, this is just a proposal. You don't have to get these people together. You just have to outline the plan the steps that you would take in implementing what you have identified as that community need. And how you're going to use the local services in that community. But there also might be other things you research that aren't local that could help locally. So, for example, what grants might be available? Because any project needs some kind of funding. So the purpose of community assessment, of course, is to gather information, identification of areas in need of improvement, and then, of course, assessment is the first step in health planning. It provides the whole baseline from where you're going to go from. So your book identifies the different types of assessment. Comprehensive assessment, population focused, which is more like a specific population, like children with asthma or school-aged children or elderly. And then and then the health impact of those assessments. And then rapid needs assessments, which you can look at. It's all very clearly identified in that chapter 4. Population focus, larger group or an aggregate. Members may or may not interact with one another, but they do share similar characteristics, or similar, they're affected by the same issue, And again, like I mentioned, you can focus on a specific age group, a gender, or a specific health issue, so identification of strengths and weaknesses, what policies are currently in place, and what needs to be developed, for example, and all that needs to be supported with data. And here this gives an example of obesity. So you might just focus on, if you identify that there's a high rate of obesity, and then you identify that all the research about how the health effects of obesity, then maybe your project has to do with maybe there's not enough safe places, or enough places for them to get exercise. And not everybody likes to go to the gym, so you might have to be a little innovative in some of the things. For example. All right, so rapid needs assessment. That measures the present and potential public health impact of an emergency. So that's more of a, like, there's been a disaster, which is not what you're going to be doing in your project. But that is part of an assessment that's identified in your chapter. Such as after the hurricane or earthquakes. Okay, so concepts of community assessment. Okay, what they need versus assets, because you want to focus on the strengths in a community. Okay, so what are the strengths of the community, and then what are needs of that community? And then again, a participatory research initiative. That's going to have the biggest rate of success. If you've got a lot of participation, you can get more of the stakeholders on board. Okay, and then of course maximize on the strengths. And then, as we've talked about, that the more you include, it empowers people, it builds working relationships, uses everyone's talents because you'll pull people from all different jobs. Like for example, like I mentioned, city planning, the health department, school personnel, whatever the project is focused around. Okay, even the local hospitals. Okay, so collaborative achieves change. Okay, community-based participatory research, engagement of community members as full partners in an assessment. Okay, so they need to be on board from the very beginning. Okay, and then benefits, equal contribution. Culturally, it assures that there's culturally competent care in a community when you involve many people within that community and many stakeholders. So it ensures that there is a culturally competent project that's going to be implemented that will have more likely to have much more success. Okay. Steps in the change model. Okay, this is identified in your book. Okay, assemble the community, develop a team, review community sectors, gather data. Okay, because you might get certain data from the police department, you might get certain data from the ER, you might get certain data from census records, okay, like morbidity and mortality reports, okay. So then you analyze the data and assign ratings to each sector, and then you build an action plan. What is most needed in this community, or what is something that could be strengthened upon? Okay. So again, these involve communities, community institutions, healthcare, school, and work sites. The planning tools for community health made up CDC, has a public health practice program office. There's the MAP model that stands for Mobilizing for Action Through Planning and Partnerships. And that is, let's see here, that is, what page is that on? There's a really good side-by-side comparison of the MAP model and change. Let's see, where is that in this book? That might be in chapter 5. Oh, no, it is. It's in chapter 4. So it's on page 85, table 4 to 2. Talks about, it's a side-by-side comparison on the MAP model and change. Okay. And it's best practice approach to public health assessment. Comparison of MAP with change is the title of that table. And MAP stands for Mobilizing for Action Through Planning and Partnerships. And there are 6 phases that are identified, of course, on that table that you can look at on page 85. Okay, and so primary community assessment. Okay, the windshield survey is what I mentioned earlier, and which is going to be the first part of your project. You're just driving around, you're just getting some data collection, kind of gives you the feel for the community, what you're seeing. Are there people out and about, or is there nobody playing outside, no kids playing outside? Are there homeless? Are there people that are out on the streets? Is there safe lighting? Is there safe sidewalks? Again, like what I said in the beginning of this presentation. Those are the things, and you want to be very specific about. Okay. The shoe leather survey is that if you could also walk around and write down what you see. So either you're driving or you're walking around and assessing it that way. Okay. So you're looking for the sort of the feeling. Is this a stable economy? Are there schools and other educational institutions around? That's certainly a big asset to any community. Is there any evidence of political activities or stands? Are there places of worship, any kind of neighborhood associations? Okay, so you're kind of getting an idea of the values of the community when you're looking at this. Okay, so secondary data not specific to individuals, but more like census data. Okay, like what's the general age of the community, occupation, general income, education level, typically of the community, those kinds of things. What's the crime report? I've already mentioned like the rate, you can find out the rate of communicable and non-communicable diseases in the area, the accident rates, motor vehicle crash rates, what's the leading cause of death, and then so you can get that in the morbidity and mortality reports for the area. And you can compare that to the national survey, national health surveys. Okay, small town versus the United States. So you can compare, what is it like in the area that you're observing or that you're doing your project in versus, within the whole population of the United States. Okay, so these are just examples of some graphs. And you might want to use some of these charts in your project. When you get your data, you can use bar graphs and charts to help explain the data you gathered. Okay, so quantitative surveys defines your sample, your specific population community. It's typically random. So for your, or there's a fixed number, but what you're going to do is you're going to create your own surveys and survey questions. So certain items in the survey, there's closed-ended questions and open-ended. Okay. We do not want you to use social media for this. Okay, there's a lot of legal issues involved with that. So there is a consent form that is on the site, on the Blackboard site for you to use. We don't want you to involve children because that is getting into a different legal issue as well. That would have to go through a review board. So we need you to interview adults. So if you're doing it on children, you can certainly interview the parents of the children. But make sure you have consent from, if you're going into schools, make sure you've talked with the school administrators and the principal and seek permission before you do that. Okay. So we want you to do face-to-face surveys, or you can hand out surveys. You can bring surveys and ask the local health department, hey, I'm trying to get data on this certain topic. Would you mind handing out these surveys these voluntary surveys to people that come through your clinic so I can get an idea of what their needs are? You can do that. Either way, it's face-to-face because they are filling it out in that institution, okay, or in that establishment. And now this is just a project. We're be happy if you get 8 surveys. I think shoot for 8 to 10. If you get more surveys returned, great, but we know that y'all have a very small time frame here, and then not everybody returns surveys. This is just to get you familiar with the whole process of a community assessment and the implementation of a project, okay, or the proposal of this project. You won't implement it, okay. And then it'd be interesting to compare community samples with national benchmarks, like where does this community rate in accidents versus the national benchmark, or in heart health, or in safety, okay, for example, depending on what your focus is on in your project. Okay, so unstructured open-ended questions, interviews, key informants. That you can, for example, that would be like if you can go to a specific person in charge of an organization and you can say, hey, this is the purpose of my project. I'm trying to do this for this data. Would you be able to question your congregation or your members regarding these issues or these questions and have them review it? But that is they're more likely to answer if it's someone they know providing the survey versus you handing it out on the street, for example. So use your key informants, okay, and leaders in the areas that you are trying to get your data from. Okay, and this is just a clicker check, so we're not going to, that's just for the testing purposes. But I wanted to record this to kind of give you some information on how to go about your project. Okay. Certainly a windshield survey is beneficial because it, see, okay? So it's a primary data collection tool. Okay. So it gives the pulse of a community. So it's just a feel. So that's why we start with that. Okay. So for your, I will go over the rubric. I will also post a PowerPoint that goes over components of the rubric so you understand exactly what is wanted there. Because your literature review is you want to look for some similar projects that have worked in other communities that you might be able to apply to this community. Okay, and some of that was also discussed in the project planning in chapter 5. I did do a recording for that, and that will be posted also for this course to help you with your project. Okay, because that is posted currently in the NU 440 course. All right, thank you. I hope that helps. Be sure to give us any, if you have any questions, to connect, to certainly reach out and ask. I also am going to be posting an example that I went to last week on a project that's being developed here in the Twin Falls area. So look for that. I'll post that soon. Thank you. Bye.